Vukovar, Croatia, 1997. A small city on the Danube devastated by 4 years of brutal war. A city perhaps best known for what is now called the Vukovar Massacre, the worst human slaughter in Europe since World War II. Rebuilding this once beautiful city and re-energizing its people would be a huge task. Greater access to information and education would be essential. The U.S. government was on the case. A U.S. embassy official in the Croatian capital of Zagreb reached out to Gary Selnow for help. Gary was a professor at the University of Zagreb on sabbatical from San Francisco State University. As part of the recovery effort, Gary was asked if he could show teachers in Vukovar how to use a remarkable new medium called the Internet. The school in Vukovar had the computers, provided by UNICEF, but they were sitting idle since no one in Vukovar knew how to connect them to a network. With the help of a couple of computer students from the University of Zagreb and a small USAID grant, Gary bought routers, cables, connectors, and other necessary equipment and got the school online. It was a new day for Vukovar. Its students could now get vital education and information from around the world. Teachers had new tools and up-to-date information with which to teach. Long-separated families across Croatia and across the world were electronically reunited. It was the start of something big. The U.S. State Department took notice. 2 years later, it asked Professor Selnow to go to Kosovo to help set up technical centers. What happened there would impact millions of lives in decades to come.
But there was a turning point in Kosovo, and it's this. We had these centers, we had 8 of them set up around Kosovo at the time, and physicians were lined up before the opening bell every morning, and that was really strange. And it turns out I was talking with them, and they said they would show up because they didn't have access to medical information. Because of the war, they too were kept away from the latest developments. And yet this was the first time they had an opportunity to access the latest medical information. And so that really got us started on, we turned from general internet access and so forth to medical work. And that's where we've been, obviously, ever since.
Since that time, Wired has set up medical information centers in 15 countries on 5 continents, training thousands of local people in distressed areas to pass on medical education and information to their countrymen, responded immediately to the Ebola crisis by creating and distributing Ebola training and information modules, the first of their kind available in the world, produced more than 400 peer-reviewed evidence-based medical information modules, offering over 100 in languages other than English, and all available free to anyone, and enabled more than 1.5 million disadvantaged people to study these presentations, often with on-site instructors through Wired-run health centers and outreach programs. This work was honored in 2009 when Wired received the prestigious Public Health Hero Award from the UC Berkeley School of Public Health. Speaking at Wired's 20th anniversary celebration in October of 2017, Dr. Richard Carmona, 17th Surgeon General of the United States, described the organization as unique.
If I had a Wired equivalent as Surgeon General, I could have changed the world. Because you have a distribution network, you have intellectual property, you have content that nobody else has. And you reach the world. And that this is more than just a bunch of good people doing nice things for poor people. It's much bigger. This is health diplomacy. My criticism of Wired as a board member was, there's only one thing I can criticize them on. They are the best anonymous organization I have ever known. Extraordinary. Nobody has done this. And they did it on a shoestring budget. And they overcame every barrier imaginable and have touched the lives of millions and millions of people and continue to do so.
What's ahead as Wired moves into its 3rd decade? Putting unique new Wired technology to work to reach millions more people in remote communities that have little or no internet access. Helping control the impact of disease outbreaks anywhere in the world through rapidly produced information modules. producing more medical education modules on more topics and getting them to millions more people in remote areas. Extending recent efforts on community immunity, the concept of protecting entire communities by educating a significant number of residents on basic human health issues. And increasing focus on One Health topics, the impact of the three-way intersection of human and animal health and the environment. It's an ambitious but realistic agenda, and it will require additional funding. You can be part of this critical global program with a contribution of any amount. Just go to wiredinternational.org and click on Donate. Your donation will make a difference. Thank you.